Okay, so hi, greetings to all. Welcome to the graduation ceremony. Happy to see you all getting graduating. I would request Paul sir to take over.
Hello, everyone. Can you hear me?
Yes.
Good morning. We can hear you.
Wonderful.
Good
All
morning.
right, excellent. Excellent. Just stop sharing the PowerPoint presentation for a minute. Let me just welcome everybody. There you go. Yeah, please, everyone, if you can, if you have a moment and you're able to, depending on where you are, switch on your videos so we can all see you. Beautiful. I see several of our faculty and team members. Thank you for organizing this. And we have one of the largest graduating cohorts with 34 people graduating, which is wonderful. So you all get to see each other. I see backgrounds of Global Fund. We know we have Rwanda Medical Stores. We've got Chemonics and various others. I know there's one from NHS as well. So yes, please switch on your cameras if you can, and if your bandwidth allows you. Okay, wonderful. Welcome everybody. Okay. All right, let's get to the presentation so I can introduce what's going to happen today and how we're going to take this forward. I see a lot of familiar faces, friends who've struggled through and achieved their graduation, balancing and juggling all their different activities. So you're welcome. And I would just like to introduce a couple of people who will wave. We have Nicola, who's one of our student advisors and technical advisors. Nicola, if you can just wave. There we go. We have Kavita Nair, who's one of our directors. There's Kavita, wonderful. And later on, you'll get to meet our education team that has put all of this together, and especially Priya, with whom you're all coordinating. Okay. All right, wonderful. Are we ready? Are we ready for the graduation?
Yes, we are.
Yes, yeah.
Okay.
Yeah.
All right.
Yes, we are ready.
Excellent. Priya, we need one more slide for next time, where we say how long it took people to graduate as well. I think that would also be useful. We estimate 1 year, but there are people who do it in less and some who need more. Okay, that'll be a good metric. It'll be a good metric to show and share with others. Okay. All right. Welcome again. I'm joined by Prof. Andy, whom you all know, and it's that voice that you probably hear in your dreams because he's given the lectures of most of the courses, and you'll get to hear from him as well. Next slide, please. All right, so we'll move quickly because each of you will get a chance to speak, and I want to make sure that we finish on time. I know many of you are currently working and you'll need to get back to your offices. So we start with confirmation of attendance, opening remarks. Andy speaks then. We hear from our top graduate. Again, we go back to Andy. And then the sharing of the experiences. This is the part that I really enjoy listening, listening from you. And each one of you gets about a minute to speak, okay? And the final remarks from Prof. Andy again. Next slide. So there was a time when people knew me, but they didn't know Empower. And now people don't know me, but they know Empower. So briefly, let me introduce myself. I'm the founder and executive director of Empower School of Health. And just to give you a sense, I had no idea where my journey was going to take me. I was born in a very small and let's say a not so attractive town in India. This is going back many, many years. I'm probably the oldest person over here. That journey went from India to UK, from UK to Nigeria, where I spent almost 7-8 years, from there to the US, then to Geneva, and where I was with WHO and the Global Fund. And then after that, founded the Empower Swiss and Empower School of Health in partnership with the UN and other agencies as well. Okay, so it's a full circle. The reason why I mentioned that is anything is possible. So whatever you may, I didn't dream of it, but it happened. But if you apply your mind and if you dream, it is indeed possible. Okay, next slide. All right, who do we have today? So by country, we have, I think, about 14 countries. Cameroon, Rwanda, Haiti, Zimbabwe, Uganda, Malawi, Lesotho, Zambia, UK, Gambia, Nigeria, and then Sierra Leone, Kenya, Swiss, Ghana, Ethiopia, Botswana. So we have developed and developing countries. We've got the Americas, we've got Europe, we've got Africa. Interestingly, I don't see anyone from Asia in this one. I guess they haven't finished their graduation yet, but then we have normally a few from Asia as well. Okay, next slide. The organizations represented by our graduates. You're all familiar with the World Health Organization. I see that Global Fund is missing. We saw someone with the background of Global Fund, so we'll make sure we add that when we come rework this. And if your organization is not represented here, please send a message, or you can put it in the chat right now as we are speaking. So we'll be sure to include those logos as well, because we'll be sharing this PowerPoint with all of you. Priya, are we normally doing that? Are we sharing the PowerPoint with all the students?
Yes, sir. We can do it.
Okay, yeah, we can do that. But what you do is you just remove the certificates of the other people and just keep the certificate of that individual.
Yes,
okay?
Yes, sir. Noted.
All right. So yeah, please type in the chat if your organization is missing. Yeah, I see Save the Children. And let's see who else. Ministry of Health of Uganda is missing. MSH is missing. And Ghana Health Service. So make sure we add all of them. I think we have, of the 34 graduates, we should probably have about 25 different organizations. Okay. All right, next slide. So I always find this this slide very important and very telling. What it mentions is the kinds of individuals that we have, our graduates, range from young individuals and professionals with about 5 to 7 years experience. And then we have individuals who are CEOs, executive directors, and we've in the past even had a former Minister of Health who is our graduate. Okay, so it's really it's very special to know that the area of supply chain is considered, of course, for us, it's our life. Everything that we do is around this. In fact, my family and children and my wife laughs because every time the word supply chain comes up, they go, here goes Professor Paul again talking about supply chain. But now when we go shopping, it's all about supply chain, okay? So there's supply chain in every aspect from that way. So it's really amazing the kind of graduates that you have and you'll be connecting with come from all walks of life, senior to junior. May I please ask everyone to mute their microphones if you're not speaking? Okay, thank you. Next slide. So if you look at the distribution, we have one person with the highest distinction, and we'll hear from her later on. 9 with distinction, 19 with merit, and 5 who have passed. Okay, so all of them deserve and absolutely, you've all graduated. Now, a lot of this has to do with how much time you were able to squeeze out to do between family, work, and education. But regardless of which category you're in, you should feel good that you've made it through the whole process. And of course, we will felicitate the individual who's managed to balance everything and has scored really well as well, okay? And we can ask her about her secrets of how she did it. Next. So you'll get to see a few of the faces. I know it's a bit small, but you've got 15 people here. As we had mentioned, if you don't see yourself, or if you see yourself and it's not correct, or the title, any of the details, if they're not correct, please let us know, okay? And we'll be sharing this PowerPoint with you anyway. Next slide. And here we have another 15 people from all the different countries that we had laid out. Again, please look for yourself, see if you have the right name, designation, organization, and country. Okay. Next. And we have 4 more. And we have 1 missing photo. So if I could ask Raymond to make sure you send your photo to the team so that we can include you later on as well. All right, next slide. With this, I introduce you to my friend, my colleague, someone I've known for more than 20 years. He really is extremely special, not only to me, but to all the students and the learners. And if you've had a chance to meet Andy personally, you'll realize he has many special qualities. So while you're reading about his background, and yes, he's incredible. He's a teacher. He's an author. He's written that yellow book that many of you are familiar with on supply chain. He's worked in many countries with many organizations. But what's also very special is that he is a Buddhist monk. He was born a Christian, but over a period of time realized that he would also need additional skill sets, and has dedicated himself to Buddhism. And the journey for him to reach there was incredible. So for me, he really is a 360-degree type person, having all aspects, balancing all aspects, or doing his best to do so. Andy, I hope I've embarrassed you enough, and with that, I give the floor to you. Okay.
Thank you. Okay, let's go to the next slide then, please. So my key message of today is congratulations, well done. You all made it through, every one of you. Congratulations, and when you get a chance to speak later, please congratulate all the other candidates as well. We know it's not easy, we know it's tough, and you've made it through. Next slide, please. But for you, congratulations is not enough. We need double congratulations, because not only have you done this course, you've also had to balance everything else. Your work, your life, your family, your religion, every activity to fit around this course, to find the time to do this course. It must have felt like trying to push a boulder up a mountain at times when you were doing this. We know how hard and how tough it can be. But that is the depth of material involved in health supply chain. Double congratulations. And the next slide, please. But we're not yet done. Quadruple congratulations, because you also had to do it during the time of COVID, when there was lockdown and pandemics and hand sanitizers and masks and all kinds of things going on to disrupt you and take you away from your studies. And you managed to come through. So for this class, quadruple congratulations. You've really done excellent to balance everything and to get through. And when we come to the awarding of the certificates, if your family is with you, please bring them into the room to watch. Please bring the kids and the spouses with you, because they share in that. They've helped you get through this by allowing you the time, the ability, and the focus. Next slide, please. You've graduated, but remember, there is the alumni organization. Various ministers have said various things about the course, lots of organizations, lots of profile. Please do sign up for the alumni. Keep in contact. Don't just listen to white-haired old professors. Exchange information with your counterparts in many different parts of the world. They've got answers, they've got solutions as well. Use the alumni network to keep in touch and share and obtain information. Well, we put you through this course, but okay, you want to go back? Go back a slide, please. Right, now go forward one, please. Okay. Excellent, okay. We've put you through this torture of this course, but how do you know it really works? How do you know it's really got an impact? How do you know it's really made you better at procurement and supply chain? Well, I'm going to give you a practical case with the evidence here. During COVID, WHO developed the essential supplies forecasting tool for COVID commodities. It was an Excel-based quantification sheet, how to calculate how many COVID commodities you need, how many masks, how many gowns, how many ventilators, everything you need to treat COVID patients, all in an Excel quantification sheet. It was morbidity-based quantification. Some of you may well have seen it, and some of you may have worked with it. Next slide, please. All the staff who had completed the postgraduate diploma course could use this tool immediately. 1 or 2 hours, they're familiar, they could use it, they could do the quantification. The staff who had not had the postgraduate course training were confused, they couldn't understand what it was all about. So during module 3, I tortured you with Excel sheets and doing calculations on consumption, forecasting and quantification, and morbidity from first principles. We did it all the way through. And I'm sure some people were saying, why are we bothering? It's all on computers now. Well, no, it wasn't. And this WHO Essential Supplies Forecasting Tool is a real example of the people who had the knowledge and the skills from undertaking the course could use it and run with it immediately. Nepal was a prize example. They'd had the training, they understood it immediately and went with it. Next slide, please. That tool is available to you. There's also a free training course available around how to use that and COVID commodities in general. That was also written by Empower. The link is on the screen if you want to look at that as well. It's a WHO course written and produced by Empower. But having that knowledge enabled people to use those tools immediately. That's the skill sets that you now have. That's the knowledge that you now have. Well done. Next slide, please. Procurement and supply chain management is not new. We've got the Yellow Book, published in '82, the WHO Estimating Drug Requirements, published in '88, and the USAID JSI Logistics Handbook, published in '98. So these are all 40 years old. We really should have all this knowledge in place now, but as you've discovered, it's often not in place, and you've had to learn it and develop it. Next slide, please. But PSM is really not new. If we look about consumption quantification, you'll find that in the logistics of the Roman army, a papyrus from 2,000 years ago. It's often said that Pythagoras, and you might just remember that from school arithmetic, about the square on the hypotenuse and triangles, Pythagoras was the first logistician. He made the calculations, exactly the same calculations that you did for consumption quantification in module 3. So after 2,000 years, we really ought to be able to do quantification and supply chain by now. It's well-established procedures, but unfortunately, those skill sets are not universal. You now have them. Next slide, please. Of course, we've got to keep up to date. You're used to looking at references, you're used to finding information. This is a joint FIP WHO on new curriculum, new training, new standards. Please do keep up to date. You've been empowered now. You understand how to obtain information, how to find those World Health and other documents that will guide you. The tools are available, find them. You have that skill set now. Next slide, please. We're going to need it. We've looked at the impact of COVID. What's the impact on the Russia-Ukraine war? It's disrupting the pharmaceutical supply chain. And that means our pharmaceutical supply chains need to be more resilient. COVID, we said less than 4% were prepared. We've got to get prepared. As COVID starts to wane away, other challenges come along, like the Ukraine war. Everything is vulnerable to it. We have to build resilience. You now have the skill sets, you have the knowledge to help build that resilience into your procurement and supply chains. Next slide, please. Our message now is use, apply that knowledge. Increase the resilience in a balanced and efficient way. Think about climate change. Are you ready for that? What's the impact going to be on that? Massive. So be prepared, use the skill sets, apply them, implement them. Next slide, please. Okay, I hand over now back to Priya, I think.
Okay then, so these are the top graduates of batch 17. You all will get a chance to share your experience once we share the certificates with you.
Okay, some real top scorers there. That's excellent.
Yes, 91.21% is the highest score for this batch. Then 86.89%.
Okay, and then on from there. Okay.
Yes. Then 85.01%, and last is 84.23%.
Okay, very close on the others. Yeah, very close indeed. Excellent.
Now I would request Mary to share your experience. Mary, if you can please unmute yourself and share your experience.
And Priya, you can also then stop sharing the screen.
So sorry.
Yeah, just Marie, you can you put your video on, please? Is it possible? I know it's very early in the morning for you. What time is it over there?
I put it on. It's okay now?
I can't see you. Can anybody else see her?
Not yet, no.
Yeah, Mary, don't worry. If actually, it would be nice to see you. So just try again. It would be good for everyone to see you. It's 6:25 in the morning. Huh. Okay, not ideal. You might have to switch on the light, maybe.
I think it needs more coffee.
We'll give her another minute. Actually, just to understand the time zone for anybody else. Did we have anybody from the Pacific, by the way? In the past, we've had people from the Solomons, Papua New Guinea, Vanuatu, Fiji. Do we have anyone from the Pacifics while we're waiting? Nope. Anybody else where it's earlier than 6:25 a.m.? Nope. Okay. Murray, let's try it without the video. Can you hear me? You're on mute. Maybe we come back to her at the end. Okay, let's move on. We'll just, while you, I think, Andy, you are continuing. I'll just send her a message to Marie that we come back to her towards the end. Okay. All right.
Okay, so the certificate is conferred when I read your name. Please forgive my pronunciation. If there's any problems on the certificate, please contact Priya and we will correct it before it is issued to you. We're allowing you 60 seconds to speak. And we have a special arrangement with the Wi-Fi. If you go over 60 seconds, we're going to put 2,000 volts down the line. Just to remind you that you keep within the time frame. 60 seconds, okay? You state your name, your designation, organization, and country, and then you can share a short message, your experience about the course as we go through. Okay, next slide, please. Okay, Kamola, Adiola, Pajobi. Please unmute, and you've got 60 seconds. Kamola, are you with us? Can you unmute?
Sir, I guess she's not.
Yeah.
Not online.
Yeah.
Okay.
Yeah.
And next slide,
keep
please.
updating us. Exactly.
Yeah.
Yeah. Keep updating us if someone's not there. Yeah. Please go ahead.
Next slide, please. Okay. Nesengiamana Amon. You're online, please unmute. You have 60 seconds. State your name, your designation, your country, and your message.
Yes, hi everyone. Thank you so much. I'm really excited to be graduating today, and thank you Empower School for having scheduled this course to be flexible for everyone, even at work. So regarding my name, there is a simple mistake. It's not Tsengi Ayemana. There is A that should be removed.
Okay.
Thank you.
Okay, then we'll go on to the next, please. Okay. Keleso Odiril. Please unmute.
Hello, everyone.
Greetings.
The names are okay on the certificate. Yeah, I guess everything is okay.
Right. Your country and your designation, please.
I'm from Botswana. I'm a pharmacy technician. I'm very grateful and excited to be graduating today. It's been an exciting journey. I'm really happy I managed to get the opportunity to study the course, and I've learned not a few, but a lot of things about supply chain of health products, and hope I'll be able to apply my skills in my career.
Where
Thank
are you
you.
based? Where are you based in Botswana?
I'm based in a hospital in Silebepikwe. It's a town.
I know it. Yes. Okay. It's a long time since I was in Labatsi, but okay.
No, Silebepikwe, not Lubat.
Yes, you were in Silebepikwe, but I was in Labatsi. Okay.
Oh, okay. Yeah.
Right. Next slide, please. Edway Mafo Maurice.
Yes,
Maurice.
I didn't. Yes.
Go ahead,
The name
please.
is, yes, the name is okay for me. My name is okay. So it's good.
Right. And your
Anything.
country and designation.
Okay. I'm basically a pharmacist. I'm from Cameroon. I'm actually working for management science for health. So
Okay. So did I a
Yeah.
long time ago. Right. Any comments on the course?
concerning the course, it was a very interesting course. I learned enough because I was wondering if I would learn something as I was enrolled in the course when I was a director of medicine at Cameroon. So it was very wonderful for me when I attended the course, and I learned a lot. This is very good course, and I actually recommend it for everyone. Thank you very much for this course.
you.
It's a very good one. Thanks.
Okay. Simbarashe New Bawari.
Hello, how are you, everyone?
Greetings.
Thank you. So nice to be graduating today. Thank you so much for this time. My name is Sebastian Mbaware. I'm a pharmacist by profession from the Ministry of Health and Childcare, Zimbabwe. And I work for the Global Fund Programs Coordination Unit in Zimbabwe under the Ministry of Health. And procurement and supply chain is my day-to-day life within the ministry and in implementing Global Fund grants. And these courses really helped me in achieving that and in making sure that my daily activities, I execute them so well. And with this course, I'm able to make sound decisions, and I can be able to make decisions that I can implement within the program that I'm implementing. And it has assisted me a lot in achieving this. And I hope with the information that I've gained and the knowledge that I've gained, I'll be able to cascade the knowledge to other counterparts of mine who then will be able to ensuring that we get things done on time and ensuring that we get the right products and we strengthen the supply chain system in Zimbabwe. Thank you.
Thank you very much. And the next, please. Edmore Novakite. Edmore, are you able to unmute and join us?
Sir, I guess it's not.
Not there. Okay, then next, please. Dani Karani Nedeke. Dani, are you with us?
Yes, can you hear me?
Yes, I can hear you now. Go ahead, please.
Oh, okay. My name's Aroke. I'm a company pharmacist in Afrisol Pharmaceuticals, Kenya.
Okay.
I'm proud to finally be here. It has been exciting and challenging altogether. The videos and notes were well laid out and easy to understand. I found the project quite challenging, but through your support, I managed to complete. I'm glad to say that I'm applying most of the skills I have learned in my daily work, and I can highly recommend this course to all other my colleagues. Thank you for the support and congratulations to other graduates.
Excellent.
Thank you.
And the next, please. Mafu'u Dibu Jolly Vivan. Vivian, sorry, Vivian. Okay. Vivian, are you with us?
No, sir.
No, okay, then next, please.
Okay. She's here.
Yeah, I can see you now, Vivian. Please go ahead.
And we had to adapt. And I hope all the
We've lost you. We can't hear you. I can't hear her. Can you hear her?
No, maybe if you stop the video and just try on audio. Okay, Vivian, we'll try and come back to you. Let's move on. Peter Ishimwe.
Can you hear me?
Yes, I can hear you, Peter. Go ahead, please.
Yes, yeah. My name is okay. So I'm called Peter Ishimwe. I am from Rwanda. So when I started the program, this course, I was working for Chemonics International under the USAID Global Health Supply Chain Procurement Supply Management Project. But now I'm working for Swiss TPH under the Global Fund LFA mandate. So first of all, congratulations to all my fellow graduates. So we took the course that challenged us to think critically, that helped us to refine our understanding, knowledge, and skills to strengthen the supply chain system of health products within our countries. So since module 1, for me, I was able to connect with the course content and be able to connect it with my daily work and deliverables. So the course covered where the life cycle of health products up to the last mile, our clients. Of course, the journey wasn't easy. We had to study and to balance it as was presented in the slides with our daily work at the same time. Luckily, the program is flexible to allow students to access the course at our availability. So allow me to just thank Empower staff for your support, quickly responding to our queries, mainly prior through the entire journey. And my special thanks goes to Chemonics, who paid for the fees for me to attend this course. Now, I feel like everyone is now equipped and ready to go out to bring change that we all want. Thank you, and have congratulations again to everyone. Thank you.
Many thanks. And the next, please. Trésorier Jean-Christian.
Thank you so much. My name's Aroke, and I'm from Rwanda. I work from Chemonics International under his project called USAID Global Health Supply Chain Program. I'm very happy to graduate on postgraduate diploma in Global Health Supply Chain, and I'm thankful to Empower School of Health and Chemonics for their collaboration to give me that course. I'm very happy, and congratulations to my colleague. Thank you so much.
Excellent, thank you. Okay. See, next, Letitia. Letitia. Okay, see, next, Letitia.
Okay.
I'm sorry if my pronunciation is so bad.
Okay, thank you. It is I am from Cameroon. My names are correct. So I want to thank Monique for giving me the opportunity to grant this scholarship. It was a fantastic journey. I wanted to thank all the staff of Empower for their patience, and I hope this diploma will permit me to grow up in my career. Thank you again to everybody.
Okay, many thanks. And the next, please. Chukwu Izioma Ann.
Hello, everyone.
Greetings.
Greetings, Professor Andy. Thank you so much. Thank you, the team, Empower team, Priya, and everyone for their support. For my name is correct on the certificate. The names are correct. So I am Chukwu Ezioma Ann, a Nigerian, and I work with AIDS Healthcare Foundation, Nigeria, precisely in Cross River State, Calabar, Nigeria. I work as a medical laboratory scientist. My journey in postgraduate diploma in procurement, supply chain management. Well, I would say is amazing, though from when I started the course, like you said, during the pandemic, I became discouraged at a point because I lost my dear dad, and I had some emotional trauma up and down, but thank you, Priya, and thank you also to Pharmacist Samson, have run a professional education consultant who was there encouraging me to press on, you know, and others. Like Professor Andy rightly said, it's not easy to juggle between job, family, your course, and every other thing. It wasn't easy, but I'm grateful, and I congratulate everyone, all the graduates, that are all my fellow graduates that made it through this course. And I say thank you to Empower to what you do. And I look forward to using my experience, because I would say the course has really, I've really improved so much, to the point that in my state now, where I cover in Cross River, my state clinical coordinator has given me everything logistics to take care of. And before now, I was finding it difficult to do, you know, doing a physical count, doing other things. But now I'm actually seeing some of the flaws we are having, and I'm bringing it up in all my reports, bringing up the challenges, and also bringing up strategic solutions to that. So I say thank you so much for bringing out these potentials in me. Thank you.
Thank you. Okay, many thanks. And the next, please. Angela Isata Kekai.
Hello, everyone.
Greetings.
Good morning and greetings. Okay, the name is correct. I am Angela Isata Kekai from Sierra Leone. And I'm a pharmacist attached at Sierra Leone Psychiatric Hospital. My journey so far, well, it has not been easy, but it is interesting, because you'll have to schedule yourself to meet up with classes. But the course in general has been very helpful. With the knowledge gained, we'll be able to strengthen the supply chain system wherever I'm working. And it has well prepared me for my career. So thank you to the Empower staff, Professor Andy, Priya, for always responding to our queries. And congratulations to everybody once again.
Okay, many thanks. And the next, please. Vanessa Piasson. Vanessa, are you with us? Are you able to unmute?
So we can proceed.
Okay, move on. Yep. Next one, please. Philippe Marion Taché.
Hello.
Greetings.
Greetings. Yes, I'm Philippe Marion Tache, public health physician from Cameroon, as the other members. So, yeah, for this particular training, I might just tell a bit of story because I started the training. I registered for the training like 2 years ago, where I was working initially with Chemonics, and then the workload was too heavy. I could not continue. Then I stopped, and then I resumed the training last year. I think it was in April or May, and now I'm able to complete the training. Working currently as a health product management specialist for the Global Fund, supporting some of the countries that we are working with in the LAC region. So I'm really thankful to the Empower School of Health and its dedicated staff. The knowledge I got through the postgraduate diploma training makes me feel as a privileged person who was able to apply what he was learning on a daily basis with some respect of colleagues when it comes to referencing during discussion and advice. So the course is really practical with strong real-life content, making it ready to go for implementation for all PSM professionals. I really recommend this course to anyone in global health, procurement, and supply chain management, and special words to Priya and Prof. Andy for their availability and support. Thank you again.
Hey, many thanks. And the next, please. Haryamana Pai.
Yes, hello everyone. My name is Pai Harimana. I'm from Rwanda, CEO of Rwanda Medical Supply. Well, first of all, thank you for the opportunity. I thank Empower School of Health for this opportunity to undertake the postgraduate diploma. It came really in the right time when I was appointed to start Rwanda Medical Supply as a company. Having no skills in supply chain, and I thank also the Empower School of Health. You just tell people that you don't have to be a medical field. You don't have to have a medical field to undertake the course. And personally, I gained a lot, and it helped me to develop some guidelines, some documents that we are currently using, and also improve the supply chain in Rwanda in general. So it was really a pleasure and an honor to chat with you, Paul. You've been patient to me, and I have not much to say, but keep it up. It was really amazing. Personally, I nominated myself to be ambassador of Empower School of Health, given the knowledge that you are giving to all who are undertaking the course. Thank you very much.
Hey, many thanks. And the next, please. Marie-Darlene Augustine. Marie, are you able to join us now, Marie?
Greetings.
Greetings.
I'm ready. Greetings, everyone.
Yeah, we can hear you. Please go ahead.
I'm Marie-Darlene Augustin. I'm from Haiti. I would like to express my deepest gratitude for your determination and enthusiasm to assist students. I truly appreciate your learning process, supporting those who, particularly in a difficult context. Supply chain management is complex, but with your learning process, it's easy to apprehend the notions. Now, being more professional in my role, I have been able to get better opportunities in my professional career. A big thank you again for your professionalism, and a big thanks for Chemonix for the scholarship. Thank you.
Okay, many thanks, Marie. Okay, and the next, please. Peter N. Lisulo.
Sir, he has not joined.
Not joined. Next, please. Violet Jata Nirenda.
Hello, can you hear me?
Yes, we hear you, Violet. Go ahead, please.
All right, so my name has been correctly written. I'm a pharmacist at Denia Ricards Little Pharmacy from Malawi. First of all, I would like to congratulate my fellow graduates. It's really been a nice and somehow challenging journey, but we've made it. Many thanks to Empower for making the course really enjoyable and relatable. Despite a few challenges, I can confidently say that I am well equipped as far as PSM is concerned. And lastly, I would like to thank Priya and Professor Andy for your timely and appropriate assistance. And I would really, really recommend this course to my fellow healthy wakers. Thank you.
Hey, thank you very much. And the next, please. Madame Celestine Dien. Celestine, are you with us?
No, he's not there.
Okay, then we move on, please. Lamin Najia.
Thank you, Professor.
Yeah, I'm sorry for my pronunciation.
Yeah, my greetings to all the graduates and the professors and administrators. I am
we can hear you.
really
Go ahead,
happy.
please.
I am really very happy to be part of the graduates. I'm from Gambia, pharmacy technician by profession, but presently PSM officer for National Malaria Control Program under NPS, National Pharmaceutical Service. I will take this opportunity to thank Global Fund for their sponsors and my colleagues at NPS. This course, Empower School of Health, is simply the best school I wished. I have scholarship to do the master program. The modules are very organized and the reference materials are very useful. So I will not end by, I must thank my wives, my co-workers, and especially Priyanka for her support during my time. It's not easy in the Gambia because we have internet problem. I must wait till late night to ensure that I'm available, and my wife, they understand that during that time I have to be available so that I can finish the program. Once again, thank you to my grandsons, my co-graduates.
Thank you very much. And we move on to the next, please. Rafael Odame.
Hello.
Hi, Rafael. Go ahead, please.
Yeah, good morning to everyone. My name is Rafael Odame. I think everything has been rightly spelled, and I'm from Ghana. I'm a program officer with the Family Health Division, Ghana Health Service. First of all, I would like to say Empower School of Health has done great with the program. It's such an insightful program. Personally, I've learned a lot from the program, and I can see the application of all that I've learned in my daily activities that I do with regards to supply chain management. That notwithstanding, I also like to thank the Reproductive Health Supply Coalition. I think they provided a scholarship through their laptop funding, laptop scholarship for me to get access to this program. and I'm very grateful to them. Also, I thank my director of the division. I thank my bosses as well, Claudette Diogo for the support, Angela Boateng. I thank Ifo Agri. They have all been helpful, trying to seek information, trying to gather evidence to put together my final case report. I think it has been so much insightful to me, and I've enjoyed the journey to this far. And I'm happy today to graduate with Empower School of Health. Thank you very much.
Many thanks. And the next, please. Watangola Emmanuel Mobiru.
All right. Good afternoon, and thank you to Empower School, as well as fellow graduates. Congratulations for this milestone. My name is well spelled. I can see all the letters there. And about the program, I just want to thank you, Empower, and the staff, as well as Priya, for moderating this program and coordinating it. And of course, it's been so rich in so many aspects. I did learn a few, it introduced me to some few concepts in procurement, and then as well as the write-up for leadership was really so good that we're able to, some of us, to discover ourselves and probably even our managers. So that was really good. And I also thank you that the program is a bit flexible. You can be able to juggle around work, family, and school. My only challenge is that we do not have really interactive sessions with other scholars in other places. Probably in the future would have such interfaces more and more. Thank you.
Okay, many thanks. Point noted. And the next, please. Nyametoro Ian.
Yes, good afternoon, those in Uganda and East Africa, and good morning to those elsewhere. I'm Ian Nyamitoro. I do work with the Ministry of Health in Uganda. First of all, I'd like to thank Empower for the opportunity for this course, but also to join my colleagues to congratulate the entire class, our classmates that have made it today. Congratulations, everyone. We appreciate, I personally appreciate the course. I've learned a lot through this. I actually found most of the modules applying to my current work that I do with the Ministry of Health. And I believe that with the knowledge that I've gained, I'll be able to improve in the various aspects that I do undertake my assignments. So thank you so much, everyone, and thank you so much, Empower team, for the opportunity.
Okay, many thanks. And we move on to the next, please. Maumbe Maniro Ferdinand.
Okay, thanks a lot. Yes, my names are well written. Firstly, I give congratulations to myself and to my fellow colleagues to have completed this course. It has really been a long journey to this end, just balancing the life as talked. Firstly, I thank the Commonix International, that is my employer and that supported financially to pay this course. I'm working from Rwanda with Commonix International in its USAID project, Global Supply Chain PSM. I enjoyed the course. I get really what I wanted. It meets my expectation as supply chain professional now. It was really tailored, relying on most practical context, meeting or with my daily activities. My also other special thanks goes to Empower School staff. Priya was really responsive to our several emails, my family also. And lastly, I would like to request my colleagues to empower others as the Empower has just empowered us. because it is saying knowledge is not power, but the implementation is power. So let's implement what we have gained from Empower to empower ourselves and to our co-workers. Special thanks and have a nice graduation day. Thank you.
Thank you very much. And we move on to the next, please. Ibongo Lionel Jr. Lionel, are you with us? Okay, we move on to the next, please. Mambo Caroline Nateske.
Thank you. Thank you, Professor. You tried your level best.
I did, but I know it's not easy.
Congratulations to fellow students for making it this far. Special thanks goes to Priya and Prof. Andy. Today, I'm filled with great sense of happiness and accomplishment. I must confess at this juncture that the 2-year journey was not easy. There was a time I thought I would not reach the timeline. And this moment is a culmination of 2 years of hard work, sleepless nights. But here we are celebrating yet another milestone in our profession. We embrace every moment that we interacted with Professor Andy and Priya, and no words can express our gratitude for the skills, knowledge, and experience imparted to us as students. We therefore promise to implement all the procurement and supply principles. And embrace our profession and change the mindset that procurement and supply chain are a breathing ground for corruption. As we have seen, though it is true because we have experienced that during the COVID procurements, that people, organizations did enrich themselves. Now that I'm on the master's doing my thesis, I encourage all fellow students who are graduating today to take up that course. I'm also looking forward to enrolling for a PhD now. Thank you. We are so empowered, I must say. Thank you, Prof. Andy.
Excellent. Many thanks indeed. And I'm really pleased that you've enjoyed it. Okay.
I'm enjoying it.
Okay, this is a difficult one for me, Kenzo Mamoteba Mataleni.
Greetings from the mountain kingdom of Lesotho.
Hey, Dumelaba. It's
Yes, my name and everything is correct. And as it has been stated, my name is Kenzo Matlanyane. I work for the Ministry of Finance and Development Planning under the unit called Project Management Unit, which is the principal recipient of the Global Fund grants in Lesotho. I am a pharmacy technician by profession, but I currently work as a supply chain officer. So first of all, let me congratulate all the professionals graduating today. I know it hasn't been an easy ride, having to juggle work, family life, and schoolwork, but we committed our time and efforts to this course, and that's why we are patting ourselves on the shoulders today. My special thanks to Empower School of Health for this course. This is a great course. Many thanks to you, Prof. Andy, and you, Priya, for your assistance. And the lesson that I have learned from this course, will not only improve me as an individual, but also contribute to the improvement of the national supply chain management systems in Lesotho. I have already recommended this course to my fellow supply chain colleagues in Lesotho. I think you will be seeing many of them from now on, because indeed this program is comprehensive and it keeps us abreast of the new developments for having resilient supply chain systems. And then finally, I wish to extend my gratitude to my family and my friends for their unwavering support. This one is for you guys. Thank you so much. My colleagues, the Incredibles, you guys were awesome to me. Thank you so much. And then once again, congratulations to everyone. Thank you.
Many thanks. Okay, and the next, please. Dasevi Bryce, possibly Breeze.
Good morning, everyone.
Greetings.
Greeting from Haiti. The spelling name is correct. I want to thank the Empower School of Health, all the team for this opportunity. It was a great journey with this learning course. It was a great experiences, and I will apply all these skills that I gained to the course to continue to contribute to my country to improve the supply chain in Haiti. Thank you.
Okay, many thanks. And the next, please. Wandi Magagan Nagash Wadajo.
Yes, good morning, good afternoon, everyone. So my name is spelled correctly. I'm from Ethiopia. I'm currently working with Samaritan Pulse International as a dark technical advisor. Just to say a few words, before joining Empower, I served as a supply chain manager and a procurement manager in Ethiopia and South Sudan as an expatriate position. And I believe that my knowledge of supply chain management was comprehensive, though it was not until my enriching experience at Empower that I realized the depths of knowledge that awaited me. So just to say again, a few words, looking back on my time at Empower, I am grateful for the professional and personal development I experienced. Not only did the program increase my knowledge, but it also honored my critical thinking, problem solving, and decision-making ability, provided me with the tools necessary to navigate complex supply chain scenarios in the field of global health, procurement, and supply chain management. So the reason why I'm saying this one, because I have been just also a member as well as a focal person for pharmaceutical procurement as while I work for Save the Children International. So I gained a lot of knowledge thanks to Empower School of Health, and thank you, Professor Andy, and the entire team. And congratulations to all. Thank you.
Many thanks. And the next, please. Nijiko Tiare. Can you unmute, please? I'm sure I've seen you on the list. Okay. Okay, then we'll move on, please, to the next. Lambi Joyce Lambif Tumasang.
Present, I'm here.
Yeah, go ahead, please, and speak.
Greetings, everyone. I'm Joyce Lambi Lambif, well spelled, from Cameroon. I'm a pharmacist by training. And I just want to thank the whole team, the Empower team, Priya, Amal, Professor, for the endless efforts and support you've given to us. It's been a very tough journey being a full-time mom, working mom, and transiting between two towns for work. It's really not evident. So my mindset has changed since I started doing the course, and I've been able to get the partners, Chemonics, to support a supply chain training for the whole region, which carry about 37 people. And at that time, I was working with the government, and now I'm a consultant, field logistic manager with Chemonics. I can't go without thanking Chemonics for sponsoring, for the scholarship. I thank in a special way as well my parents, my sister Eileen, my brothers, and my husband and kids who have been all the way behind me. Without them, it wouldn't have been possible. So thank you, Professor, and I'll recommend this course to anybody, any day, anytime. Thank you.
Many thanks. And the next, please. Ineto Ezechi Raymond. Raymond, are you with us? Okay, we'll move on to the next, please.
No, hang on, wait. We can see him, but we can't hear him.
Okay. I couldn't see
Could
him
you
on
just check, yeah, could you check your microphone? No, unfortunately, we can't hear you. We'll come back to you, Emeto. Just check your microphone in the meantime, okay? We can't hear you, all right? Yep, please move on.
Right. Okay, that's it. So we just checked the ones we missed, which is Vivian. Vivian, can you join us now? No, Vivian and Raymond.
Keep going, just mention a few more names.
Patience
wait,
Kamani.
Yeah.
Yes,
My
yes.
name. Okay, Patience, go ahead, please.
I hope you can hear me.
Yeah, we can hear you.
All right, thank you so much, Prof. I am Patience Command from Malawi, a pharmacy lecturer at University of Livingstonia, Equindane College of Health Sciences, and a member of the Pharmaceutical Society of Malawi, the Vice Secretary. My journey with Empower has been quite thrilling, I must say. I have attained life-changing knowledge, which I'll apply in my career. I would like to thank the Empower team for the partial scholarship, which made it possible for me to complete this course. And I must say the Empower team was very supportive. And I would like to give a special shout out to Prof. Ande and Priya, who've always been supportive, and they're just an email away. Thank you so much.
Okay, Patience, many thanks for joining us. Okay, we just try one more time. Vivian and Raymond, are you with us?
Hello, can you hear me now?
Can you
It's
hear you?
Raymond talking.
Go ahead.
Okay, thank you. So good day, everyone. Thank you for putting this program together. I am a pharmacist and I work with Management Sciences for Health in the GF Malaria program as a supply chain management system specialist. So I started this work in 2020 and I'm glad I'm graduating at this time. The course was very informative, especially as it helped me to understand the principles behind some of the things I was already doing. So still, it's helped me kind of now bring in the background knowledge to help the design of special things like a resupply plan. Like has been stated here severally, it was actually very tasking and challenging to complete the course. And family support helped me, especially my wife, who kind of always had to remind me of when to take the course. And I must also say that the course, it was well designed, both visual and audio. So some of the times, maybe I could just play the course and listen while I'm doing some other things. So the only challenging part of the course was the project, but I was able to get through with guidance from it. So my appreciation goes to everyone, Priya, Samson, and then every other person in the Empower team. Thank you so much.
Many thanks. Okay, that concludes our award of the certificates.
Can you hear me, please?
Yes, sorry, Vivian, you're back with us.
Hello.
Good, excellent. Go ahead, Vivian.
Yes. All right. Thank you, Professor Andy. Thank you to the Empower group. Thank you. Special thanks to Priya for always being there checking on us. All right, I want to thank my family and really thank you for the privilege of partaking this course. This course has helped me a lot as I'm a pharmacist involved in the procurement and supply chain unit. So most of, if not all of the notions, the lessons which I got from here, I really started applying them and it has made my work easier. So I'm so grateful for being part of those who were awarded this diploma and this scholarship. Thank you very much.
Many thanks, Vivian. I'm very pleased you could join us. Okay, then I can hand back to Priya. That concludes our award of the certificates.
Thank you, sir. So now this is the convocation document and the picture of a graduation box that you will be getting. 2 certificates and transcript, Empower memento, sticker, keychain, and badges that I have already mentioned you yesterday in the demo session. We proceed with the next slide.
Yeah, let me come in here. Okay, thank you. So what's next? As some of you have already mentioned, that you've already started your master's. So we've made a special arrangement for those individuals who completed their postgraduate diploma. With 1 more year, you can get a Master's of Science in Global Health Procurement and Supply Chain Management. And this is in partnership with the UN. So you'll get a joint certificate with Empower and the UN, and that's the United Nations Institute for Training and Research. Okay, it's a great opportunity. It took us several years to organize this and make this happen. So for those who are interested, definitely consider that. And kudos to the people who are going on to do their PhDs after our courses. That's wonderful. Next. So the alumni platform was already mentioned. It's make sure that you all join, because you're not only alumni, but you're also ambassadors, as the CEO of Rwanda Medical Stores mentioned. You're not just your alumni, you are colleagues and you're ambassadors as well, in addition to being graduates. So stay connected. And the idea is so that from here, you'll get to see different opportunities of what where you might be working, or to help you grow within your organization or move on to other organizations as well. And in some cases, what we have also managed to do is, there's one of our professionals and our graduates, Mary, who is based out of Nigeria. She's a postgraduate diploma graduate, and she's now our staff in Nigeria, working with us as a coordinator for Nigeria and across the continent. So lots of opportunities for you to grow, stay connected with the alumni platform. I should also mention and thank all the different donors and funders. You would have heard from those different students and graduates. Chemonics USAID has been extremely supportive of their staff and of the staff in ministries of health. We understand the challenges of individuals not being able to pay the full tuition. So we either organize scholarships, partial scholarships, different payment terms, and we also negotiate with your different employers to inform them of the possibility of paying for the various tuition fees that you may have. Chemonics that way is very generous and covers, they would have, I think, 20–30% of our students have been covered by Chemonics USAID. There's also the Global Fund that has covered many students. Others include MSH, CordAid, laptop. You heard RHSC and laptop and Save the Children, and not to mention a few others as well. So please do mention your success story to your employers, so that others who are interested and can't afford it will also be able to join and grow in their career in procurement and supply chain. Next slide. I already mentioned about the ambassador program, the opportunities for short-term assignments. So depending in which country you are, we have several individuals who support us coordinating with IAPHL, which is the International Association of Public Health Logisticians, working with people that deliver, working with the ministries of health. So whatever you're doing in your country, there are lots of other interesting ways to grow your profession while you're full-time with that entity as well. So stay connected with Prof. Andy, write to him, write to us, write to Priya, or whoever your contact person is. Right? Next. And with that, I leave the final remarks to my mentor, Prof. Andy. Over to you, Andy.
Okay. So now you've graduated, but more than that, you've all been empowered. You know what to do. The message now is my time is over. I'm an old man. I've been doing this for more than 30 years. It's now your turn to go and advocate, to push forward the changes that are needed. Please go out there and change the world. Many patients need us. They need the work that we do. They need the supplies that we get delivered. Thank you. And the next slide, please. I think we're into. It's been hard. Everyone says it's hard. Elon Musk is not noted for supply chain, but even he says this supply chain stuff is really tricky. Yes. He can build electric vehicles, but he can't do supply chain for his electric vehicles. But even some of the world icons are starting to realize just how difficult supply chain is. But you can do it, you can make it work. And if NASA can get a man to the moon and back on a rocket, we should be able to get all the medicines and products to one of our points of care. We don't need that much technology. We don't need that much involvement. We can make it happen. Next slide, please. I think I'll leave the final words to you, Paul. Yeah.
Well, for the final words, I say that we stop sharing the screen and we ask everyone once more to share your videos so that everybody sees each other. You've transformed from being a student to a graduate, and you all get to see each other once more, okay? So, all right, wonderful. We can take a screenshot. So everyone, if you can turn on your videos, Priya and team, you can take some screenshots and move on to the best smile, please. The happiest, the best smile, everyone. And if you've got your family members with you, bring them in.
Please, my colleagues join me.
Yes, bring the children.
Colleagues join me.
Everyone,
my
colleagues, friends,
school. My
children.
colleagues, please join me.
Good.
Yeah, I know you are
telling me.
Yes.
Greetings.
Congratulations, patients. Currently, I'm at the regional medical stores. In one of the
great.
Yeah. So we are about to conduct some stock assessments of health commodities. So
I see. The work. So the work doesn't stop. Okay.
Exactly.
All right.
Exactly.
You know, I remember I was
God.
we was speaking. I see some beautiful children. Hello. So these are Negash's children. Hi there. Okay.
Hi.
You know, I mean, I remember the time during the pandemic and COVID, I was trying to get a hold of Pai Hariramana or some of the other executive directors and other senior people. And I'm told, I'm sorry, I'll have to cancel the meeting. I'm meeting the head of state. Okay, because it was such a crisis with diagnostics, with supplies, with pharmaceuticals. And the only people that the head of state wanted to talk to was the head of procurement and supply chain for their country. Not the Minister of Health, not the health secretary, but the person who was in charge of making sure that the country was stocked with the right products of the right quality in an environment which was so ambiguous. You did not know what you might need or how much you would need. So the roles and where you are today and as you grow, keep that in mind. Soon, you might be invited by your president to guide them and to guide your country. And I see some very happy people, Quenzo, Matliana, dancing with a friend. All right, that's the way to do it. And I think last time we had played some music for everyone. Priya, do you have any music ready for all the graduates? Where's the Bollywood music?
Let me ask tech team to play music.
I think we need Queen, simply the best.
Yes, actually. I mean, the dancing has already started. I mean, we can always supplement it with the music. Okay, we should do that next time.
I suspect there might be some chabuco down there with the dancing team as well.
All right, that's beautiful. Listen, thank you again. Thank you for staying connected with Empower, and thank you for being our ambassadors as you go forth. Okay, all the best. Cheers. Bye.
Thank you and bye.
Thank you.
Thank you. Bye.
Thank you.
Bye.
Bye. Oh, she getting, people are getting hugs and everything.
Thank you,
Thank you,
Priya.
bye. Thank you very much.
From me. Thank you, Priya.
Thank you, bye.
Thank you and bye.
Thank you and bye.
Thank you and bye. Thank you.